Hi, my name's Taylor Thurman. This assignment is for Module 4, Pharmacology. So it's asking us to do a video about a patient that has been brought in, a 54-year-old female patient, to the emergency room. She had fallen in the park and was spotted by a jogger who called 911 after the woman screamed obscenities at her and then had fallen. She severely scraped her arm and face. The woman is bleeding, disoriented, combative, and also accusing the EMS team of stealing her purse. Upon assessment, her hands are shaking severely. She is shouting at the doctors, nurses that she needs a bottle. The woman's clothing is dirty, and the smell of stale body odor and urine can be smelt. One of the questions asked, based on your first impressions of this patient's actions and appearance, what do you suspect she is suffering from? So upon assessment and getting a little details of what is going on and that she's shouting at the nurses and the doctors that she needs a bottle, I suspect that she is going through alcohol withdrawals, especially because she is having the shaking of the hands, which is also called tremors. Upon research, this actually happens 5 to 10 hours after the last drop of alcohol is in the system, which usually peaks around 24 to 48 hours. So once the patient hasn't had anything to drink and she's severely within the withdrawal portion of the detox, basically, she starts having the tremors because her body's not used to not having the alcohol in her system, so her brain doesn't know what to do. Also, she'll have an increase in rapid heart rate. Her blood pressure will be elevated. She'll have anxiety and irritability, which these are usually seen after 12 to 24 hours, especially hallucinations and the shouting at the EMS for stealing her purse. She thinks or sees something that isn't really happening. Long-term effects could be that she has kidney and liver damage that is irreversible. You can't fix that. That's going to happen. It's going to possibly get worse over time, especially if she continues to pick up the bottle to drink. Short-term, she'll have the irritability. She'll be going through the withdrawal system. That can take up to 5 days or start improving within 5 days, but it can take a while because your body is adjusting to the differences within your system. A doctor may, for an assessment, want to check some labs, check her blood, especially for alcohol level, to make sure that there's no alcohol in her system. Also checking the liver function, seeing if there's any infections within her urine. And then some medications that could be prescribed to help with the withdrawal is Ativan and chloropoxid. The patient's having the shaking of the hands because she is going through that withdrawal system, and the blood in her body is circulating. When you have alcohol, it sometimes makes your blood thinner, so it's easily flowed through. So if you're going through withdrawals, your blood still kind of has that sensation, and also with your rapid heart rate, you're beating really fast. Your heart is just going. The blood pressure with the increase also is because the blood within the system is having more problems circulating. So your heart's having to work faster, which results in the rapid increase in the heart rate. The research question is talking about mental illness management, which includes both pharmacologic and therapeutic methods. So some of the ways that mental illness is dealt with is prescribing certain medications, like antidepressants when you have depression, or bipolarness. It can sometimes be hard to get some kind of medications approved because depending on the drug class and the schedule of the drug. Insurances sometimes want alternate routes to see what actually works for the patient. Like if you're trying to do a prior auth working in primary care, they often ask if you've tried A, B, and C of different steps to see what actually has been tried and failed. So it can be difficult to get the approval of insurances until you reach a certain degree of actions that you have tried. Some therapeutic could be seeing a psychiatrist, talking to someone, trying to get to the root of what's actually going on. Sometimes talking to someone can help. Also, you have other forms of therapy that can help, which is... So another form of therapy is just having that connection with your therapist and knowing that they agree on the outcomes, on what the goal is for the treatment. So if that comes to using both psychotherapy, which is talking, bonding, coming down to the root of what is really going on, and then also if it needs to have medications as well. So if you need to have a couple different therapy and pharmacologic ways to get to one specific outcome, it is very important, and it will have the success for reaching that goal of the treatment. You also want to make sure that both patient and therapist agree. There's common knowledge. They know exactly what they are wanting. And then as the therapist or the nurse or the healthcare team, making sure that actually happens. Also, just making sure when it comes to insurance, making sure that as a nurse you're advocating, making sure that they understand that this is the best kind of therapy for the patient. This is the best way to make sure that they are healthy, that they can live a better life, that they actually have that quality of life care.